Yes, I am. Can you see me? Can you hear me? You can see my face now. Okay. 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 Good afternoon. Good afternoon. Can you hear me? Yeah. Can you see me? Can you hear me loud and clear? Okay. But I'm not seeing anything on my screen. On this Skype. Okay, but okay, I think I need to go there so that I can see comments.
Okay, hello everyone. We are back again to continue from where we stopped yesterday, and we are already live. And in a short moment, our guest speaker will be joining. Alui Israel is already queued up to join in for the session this evening. If you're live and you can hear me loud and clear, let me read from you at the comment section that you can hear me loud and clear so that we can be quickly, as quickly as we can. Our speaker is so if he's let's know at the comment section that you can hear me. Say loud and clear at the comment section if you can hear me. Can you tell that?
Okay. Good afternoon. Good afternoon. Can you hear me?
Yes, I can hear you. Just hold
Yeah.
on.
Can you see me? Can you hear me loud and
Yes. Okay.
clear?
Are you set? I can't hear anybody. Please, if you can hear me, please, I need you to comment at the comment section so that we know you can hear us loud and clear. The speaker is already here, he's waiting for us. I think my network is lagging. You have to turn back your distance to landscape. Ali. Okay, hello everyone. We are already live. You said? Short comment.
The replay of yesterday's of us we work in places where equipment are just bought without being validated. It is wrong because you shouldn't use any equipment. You shouldn't use it to run a patient sample until it is being validated. That is it. It's like for example now you are using you are using a phone that you don't even know whether the phone is going to work well or not. You won't buy such. Now, it is expected that these processes are being put in place. The next is purchase and inventory, which is number 4. The management of reagent and supply in the laboratory is often a challenging task. However, proper management and purchasing and inventory can produce a cost saving in addition. A lot of organizations run into a lot of labs. Personnel are there, adequate inventory management, no adequate supply chain. At the end of the day, they are not able to meet their customers' needs. They are not able to satisfy their customers. Process control, this comprises of several factors that are important in assuring the quality of testing process. This includes the quality control of testing, the appropriate management of the sample, collection, handling, method verification, validation, and etc. Now, these elements of process control are very familiar to a lot of us. We'll talk about QC, talk about EQA, we'll talk about others and the rest. And the next is information management. I hope I'm not too fast. Can you all hear me? Okay, thank you. The next is management. The primary product of the laboratory is information in the form of test reports, information data, and every other thing. So there must be adequate information management. And the next is document and record. Many of the 12 quality system essential overlap each other. A good example of the close relationship is between document record and in other words, in quality management system, documentation is a fulcrum. It plays a key role in actualizing. A lot of us, maybe sometimes we go for audit and you are asked, okay, do you do this? You say, yes, we do this. We have the document to show for it. None. And a lot of us in our organization fall into issues because we don't have proper documentation. What you are supposed to send via mail to your boss, we keep telling him with math, and at the end of the day, he denies. But if there's a mail thread to show that for when those issues are brought up, you quickly pull out the mail thread, and that is documentation for you. So a lot of things, a lot of times, when you have documentation, even your daily activity, you are likely to document it. And successful people who have successful day, one of the things they do is to outline the things they need to do for that day. So documentation and record is important in every aspect of what you do as a medical laboratory scientist. Now, the next is occurrence management. An occurrence is an error or an event that should not have happened. A system is needed to detect this problem or occurrence in order to handle them properly. It creates an opportunity to learn from mistake and take action so that they do not happen again. Now, that is occurrence management. Now, the quality management system does not promise you an error-free system, but it promises you that once there is an error, such errors will be able to be detected. Such errors will not go undetected. And when those errors happen, you begin to take corrective action, and if necessary, a preventive action to ensure that those issues does not actually happen. Now, that is the part one of this whole stuff we are talking about. We talked about the introduction of quality management system. I've talked about the principles. I've talked about the quality system essentials and the definition. Now, I want to go into the very vital aspect where I want you to pay key attention. Open your ears. Why should we embrace quality management system? And that should be our take home, because what I just said, you can get it from anywhere. But what I'm going to tell you from now, you may not likely see it in books. So please open your mind, open your heart so that I get. Now, the word QMS is quality management system. I've broken that word into three: quality, management, and system. Now, why should we embrace quality management system? It engenders quality. Now, until you have a quality mindset, you can't succeed in life. Until you have a quality mindset, you cannot succeed in what you do. Now, I want us to know that quality is a differentiator. It differentiates the shaft from the real thing. I tell you, it does not differentiate. So we live in a world, in a class where people respect people who have money. But let me tell you, quality is what separates the good from the better. It's what separates what the better from the best. Now in school, somebody we all write exam, and somebody has A, somebody has B, and somebody has C. The difference between somebody who has C, B, and A is what? The quality of the knowledge you have. That is it. So it differentiates you. This is your on your back. You must enjoy real professionalism in this profession. You must be quality oriented. I tell you, irrespective of wherever you are from, quality. A lot of us have some practices that are demeaning, unprofessional. Imagine whatever you do in the lab that affects the quality of a process, that affects the quality of the patient satisfaction. It shows you how low you are in terms of quality. Now, and it boils down to you. I wish I shared when I was explaining quality. I could remember when I was some years ago when I was in school, and I saw a shoe, a very good Italian shoe to buy. The shoe is, I think it was then around 7,000 naira. 7,000 naira was really big money when our school fees was 18,000 naira. Now, and I saw this shoe, I'm like, wow, no, can I buy a shoe for 7,000 naira? And what I decided to do, I went to go and buy 1,200 naira, like 3. And I gathered it together. I started wearing it. Before second semester, I used over 600 naira to repair that shoe, and that shoe end up. Now, what you may not have it at a particular, but don't justify it in your mind. Now, just for example, somebody is telling me that to travel from here to Lagos on land is better than flight. You may not have the money to fly, but don't justify it in your mind that land is better to go to Lagos from Abuja than it. So that is it. So it starts with a mindset. Now, when I begin to understand the basis of this quality mindset, now I may just have one pair of shoes, but that shoe should be quality. And when you have that culture in life, it transfers to even your profession. You want to do anything, do it. That is why we have so much mushroom lab in Nigeria. Why? Because the people who are the owners of this lab don't have quality mindset. They just feel that the lab should be there. When it comes to this profession, when it comes to medical laboratory part, if it is not quality, it should be left undone. It should have a set of standards. Some of us will go to where we practice. It's like shrine. It's like a medical doctor that is practicing that is practicing in a shrine. You become a native doctor. Why? Because of the quality. It's not a function of money. Get this right. It's a function of the quality. If you have quality taste, it affects your life, it affects your profession, it affects the process, it affects everything you do. Okay, and you say I have 5 minutes. Okay, thank you. The next is quality, the management. Now, management is a set not the affairs of any process of anything and all those things. So you see that you cannot take quality management system out. You cannot take management out if you need to enjoy real-time success as a scientist. You must have some management skill. Because why? You have to manage your life first. Your time, your profession, what you do, what you say, the things you are involved, and all this centered around your managerial skills. So it should not be left for your
Okay, guys, if you can hear me, I wanted to know that we'll be coming back live again. We couldn't capture correctly the initial presentation by Alui Israel, but this is what we've done. We've downloaded the presentation and we'll be uploading it on our YouTube page and on our YouTube channel, and we'll be giving you access to them. So what we need to do is just stay put. In a short while, our next speaker will be joining in, and as quickly as we can hook him up, and we'll forward We'll bring him forward so that you can listen in on him. So just stay put as we make the connectivity better.
Hello, yes, I can hear you. Yeah. I can only see your picture. Okay, like from your eyes, okay, I can see you now. How are you? How now? Okay. 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 I think you can hear me very well. The one pressing it. Disease infection can cause infertility too. So how do we laboratory diagnosis of female infertility, like, or the one then go, they do what we call hormonal test. But I can tell you as a professional, there is difference between a hormonal test and fertility profiling. You can go to laboratory and maybe, let me explain. If a woman is inability to get pregnant and you go to laboratory and they take your blood, some physicians will say you should do the test second or third day of menstrual cycle, then you do 14-day progesterone or 24-day progesterone. This is hormonal test. But I can tell you that what a woman needs to do to really investigate the fertility of a woman, of what is on the ground, is fertility profiling. Fertility profiling means when a woman first go to hospital or go to laboratory to do test and is being placed on treatment, and when he's on treatment, then when the patient is supposed to go back to laboratory, then they now start profiling the system. So for blood, like I said on this screen here, you can go ahead and do. Let me explain why we do second or third day of FSH. At the beginning of menstrual cycle, that is when a antral follicle mature follicle for any woman to release the egg is normally start recruiting at the beginning of the cycle. So you can do FSH. If FSH fall within normal range, that means at that beginning of that cycle, the antral follicle is still okay. They still have antral follicle that will eventually mature to normal mature molecule. But FSH is not stable throughout the menstrual cycle. FSH is only stable at the beginning of the cycle, second or third day. But for us to know the ovarian function of any woman or the ovarian reserve of any female fertility patient, the AMH is more stable than FSH. Before, what we do in the laboratory is FSH, but now there's a laboratory that can handle the anti-Mullerian hormone. This is more stable. The higher the anti-Mullerian hormone in the system of any woman, this one shows the number of antral follicle that is being present in the ovaries. As soon as the antral follicle is depleting, is going down, the level of AMH hormone in such patient will be going down. In FSH too, if the antral follicle is going down, is diminishing, then the ovary will now produce more FSH. But now it is FSH is not stable, but AMH is more stable. So at the beginning of cycle, you can do LH, FSH, second or third day FSH. But anti-Mullerian hormone could be done at any time of menstrual cycle. And especially any woman that is above, like a protocol here, if any woman is above 35 years of age and you want to do fertility workup for such person, it is better you include anti-Mullerian hormone. This one will guide to let you know the ovarian reserve, because if anybody is giving drugs, giving injection for any woman to produce egg, if those egg is being recruited from a poor ovarian reserve, that means the quality of those eggs will be very low. So even if you do anti-Mullerian hormone and you find out that the AMH is very low, a patient could be placed on treatment to improve the ovarian reserve. Estradiol is very necessary for day 2 and day 4, and we do thyroid hormone and progesterone level. Let me correct some of professionals here. Some of us, we do only one progesterone. We only that time we do either 14 days or 24 days. I want to tell you that if you really want to really diagnose any woman, you need to do 14 days and 24 days progesterone in the same cycle. And you need to know that 24-day progesterone of any female patient need to be higher than that of 14 days. As soon as you do any of this and you do not do second, it is not easy or it is not professional for you to interpret only one single of this progesterone. It is not possible. You need to interpret 14-day progesterone with 24-day progesterone. This one will give you an insight in what actual phase. As I said earlier on, that literal phase of any woman is very necessary. So if any woman has what we call defect literal phase, implantation will not take place. So this is necessary that if you want to do a laboratory diagnosis of female infertility, the woman need to do 14-day progesterone, 24-day progesterone of the same menstrual cycle. Then prolactin is necessary. I've talked about anti-malarial hormone. Prolactin is necessary. Prolactin is hormone. If it is very high, it suppresses production of egg follicle in any woman. So, and either a woman is on the age is on the high side, or the age is a young patient, you still need to do prolactin. Like I told us, it's only anti-malarial hormone that it may be necessary as long as you find out that the patient is above 35 years of age. But endometrial biopsy and antibody and some antibody, it is necessary too, because if a woman has sperm antibody positive in his system, it means when the sperm gets into that woman's fallopian tube, the sperm cells, which is a gamete cells, will do not recognize the egg to the oocyte too, which is a gamete cell. So because there's antibody that will be coating them, so it is necessary for the patient to do sperm antibody. When you now find out that the cause of infertility want to become idiopathic, I mean unexplained. At times we run the infection test to especially chlamydia trachomatis antibody. The chlamydia trachomatis have been implicated in blockage of tubes. So if any woman has, if before you ask any woman to go and do, or maybe any woman has HLG is done, and HLG is showing that a patient has a blockage of tube, you need to run chlamydia antibody test for such patient. Thereby, even when the patient is going for hydrotubation, it will be treated for chlamydia too. It has been implicated in tuber blockage. It has been implicated in tuber blockage. Causes of infertility in males. One of it is inability to produce seminal sperm cells, and this could be in two ways. It could be the testis is not producing sperm cells, or the testis is producing the sperm cells and it has a blockage. That is why in female we have what we call azoospermia. That means a male that is, when you check the fluid or you do the test for them, you won't see any sperm cells in their seminal fluid. I can tell you there may be two reasons for this. It's either the testis is not working, or the testis is not functioning, or that maybe there's a testicular failure, that the testis is not producing sperm cells, or the testis is producing sperm cells. That is why we have what we call obstructive azoospermia and non-obstructive azoospermia. And your patient can have what we call retrograde ejaculation too, if there's a problem in the fast difference. Instead of the sperm to start coming to the fast way to the urethra, it may be going back to the bladder. Another problem of defective transport of semen transport in men is absence of seminal duct. There's a seminal duct, whereby seminal vesicle will not be, it's not forming in the patient, maybe, and although this is genetic. Then there's a problem of testicular vein that we call varicocele. This can cause fertility too in male, and these are the different. These are the problem that can. These are the problem that can cause sperm that can cause. These are the problem in male infertility. Once you able to analyze that, apart from a man having a good sperm count, a man could be oligospermia, whereby the testis is not producing sperm cells in good numbers. These are and this will affect a man getting pregnant. There is something we call hypothalamic or pituitary disorder. The gonads of a man is not getting enough signal of pituitary hormone, and this will make testes not to function very well. In that, you have what we call a lack of FSH or LH and low testosterone in man. If any man is not having good number of sperm count, you can check, you can find out whether he has low FSH or low FSH or low testosterone. Then another thing, that the another problem in causes of male infertility is environmental factors. There are some chemicals that they are toxic to spermatogenesis when they get to man system. One of them is lead, another one is mercury. Then radiation too. Like there's a study now that if you like putting your phone or laptop very close to your private area, then this thing can cause, they are very dangerous to, they radiate, they emit radiation that are very dangerous to spermatogenesis. Then smoking, tobacco smoking, alcohol, emotional stress, obesity, this also can cause male infertility. So if anybody have all this, you can very sure that he can have a problem in getting his wife pregnant. Yes, like we have what we call idiopathic infertility in female. We have the same thing in male too, whereby unexplained infertility. But I can tell you, like I said, with the advance of technology, all these tests, all this unexplained infertility, at least by now, we could explain some of them. So maybe at the end of this presentation, I will talk about it. Then what are the tests you run to diagnose male infertility? One is semen analysis. Semen analysis, in semen analysis, you have what to do apart from doing viscosity, pH. The main body of the test is count, motility, and morphology. All these results must be very good. Motility must be good, morphology must be good, the count must be normal. The count is between 20 and 60 million. If anybody is having less than 20 million, that means we call it oligospermia, and it could be divided into severe oligospermia or oligospermia or moderate oligospermia. So, and the morphology must be good, motility must be good. Then follicle stimulating hormone. As a professional, as soon as you find out that a man is having poor semen analysis result, especially when it got to do with the count, then you should do follicle stimulating hormone. When they have to do with the count, you should do follicle stimulating hormone. This way will suggest to you if there's a testicular failure or there's a diminishing in testicular function. LH is very okay. LH, that luteinizing hormone, will be very good when you find that a man is having LH and testosterone. A man is having a fairly good count, but the motility and morphology are not too good. So LH and testosterone should be done. But if you find out that all these parameters are not okay, a man will do LH, FSH, prolactin, and testosterone. Then you can do urine microscopy, you can do urine culture, you can do semen culture too to investigate if there's any infection. Then for those who have varicocele, whereby maybe they have infection in the mumps infection in the past, they can go for testicular biopsy. And what the testicular biopsy will tell us is to let us know whether the cells of the testes are still the temperature of the cells in the testes are still very okay. Seminal fructose is necessary. Why it is necessary? If you find out that a man is producing all the sperm cells dead, if a man is producing the sperm cells, maybe immediately produce the sperm between 1 hour, you find out that all the sperm cells are dead. Yes, so those patients need to do sperm fructose. It is necessary. I've told us that testosterone, prolactin, these are the hormones that you need to do when you are doing laboratory diagnosis of a male. Then there are some genetic tests. This test is not all the lab do all these tests. We call the test sperm DNA fragmentation test. Majorly, this test, fragmentation test, sperm antibody